everyone. My name is Khalid Al-Mujari, and today I'm going to talk about my fourth current event, which is going to be about the present day issues in the long term care system. I chose this topic because I believe that these issues should be addressed as soon as possible, especially now that the pandemic has greatly impacted the long term care system. I believe that revising and improving the long term care system should be one of the most important responsibility of healthcare leader. We have all heard about the impact of the pandemic on the resident of nursing facilities. Sadly, this could have been prevented or reduced if the issues that we are going to discuss has been addressed before the pandemic happened. There were a nursing facility that were able to control the spread of infection among the resident, and here we can see the nursing facility can be improved. So we will start with understanding what long-term care is and the type of care that system provide. What is long-term care? Long-term care is a system that was designed to provide services to people to meet their health and personal care needs, either for a short or long period of time. The aim of the system is to help people live as independently and safely as possible. Long term care can be provided in different settings and by different caregivers. The location and type of service mainly depend on the type and the level of care that the person needs. It's common to provide long term care at home by household members. But as the level of care increases, the need to be in a facility becomes more apparent. Long term care facilities can be nursing facilities, assisted care living, and adult daycare centers. Next, we are going to discuss the types of care that are provided in long term care facilities. One of the most common reasons why elderly people go into long term care facilities is to receive help with the day to day activities. These are basic activities that become difficult to do when we get older. Long term care also includes community services such as meals, adult daycare, and transportation services. Now that we know what is a long term care and the types of care it provides, we will discuss who needs the service of long term care. There are a lot of factors that determine whether a person needs to have long term care or not. It's also hard to tell how much or what type of long term care a person might need. There are, there are risk factors that greatly affect the need for long term care, and we are going to discuss them one by one. The first risk is age. This risk usually increases as people get older. We all know that a lot of physical and mental health issues come with aging. For example, people who develop dementia would need assistance with daily living activities such as eating, grooming, and medication management. The second risk is gender. Women are more at risk in needing long term care because women tend to have a longer lifespan than men. For example, the number of resident women in nursing homes are greater than resident men. The third risk is marital status. Single, widowed, or divorced people are more likely to need a long-term care services than married people. This is basically because they don't have a partner to take care of their daily and medical needs. The fourth risk is lifestyle. Poor diet and lack of exercise earlier in life can increase the risk of chronic diseases. Having a chronic disease can increase the risk of needing long-term care services. The last risk is health and family history. A person medical family history increases the likelihood of needing long-term care. Now we will discuss the types of services that are provided in home-based long-term care, as well as services in long-term care facilities. Let us start with the types of services that are provided in home-based long-term care. Firstly, home healthcare need to be ordered by a healthcare provider. This is essentially receiving care in the comfort of the patient's home. The type of care depends on the needs of the patient and can range from needing help with daily activities and tasks, physical therapies, and care for an illness or disease or like disabilities. Care is provided by skilled healthcare professionals at home, and home healthcare helps patients to live as independently as possible. It delays the need to be in a nursing facility, and it also less expensive than being in a nursing facilities. Home health care is usually paid through different sources, such as a private pay, long-term care insurance, and Medicare or and Medicaid. Homemaker and personal care services are non-medical care offered by care agencies, and it's given by non-licensed individuals. This type of care can be utilized without a health care provider's orders. Typically, the homemaker and personal care services are more like for support, such as transportations, conversations, socializing, meal preparation, grooming, and light housekeeping. Care agencies don't have to be approved by Medicare to provide these services, as these are usually paid out of pocket by the client or family. Friendly visitor services are trained volunteers usually organized by friendly visitor programs. Volunteers are matched with seniors living alone or homebound due to physical conditions. The goal of the program is to provide positive interactions through short visits. Weekly activities can range from reading, taking a walk, or just having a conversation with the seniors. These simple activities can reduce the risk of depression that is usually caused by isolation. Transportation services are available for people, mostly seniors, who need help to get to and from medical appointments, shopping centers, and other places in the community. Public and private transportation services are options that seniors or patients who are unable to drive or unable to use the fixed route bus can choose from. Public transportation services, also called as paratransit services, are available and flexible in catering the route and schedule of the riders. The, the cost of the service ranges depending on the type of service used. Paratransit services are usually the most affordable, followed by volunteer driver programs and private services costing the most. With regards to payment, Medicare doesn't Medicare doesn't pay for the transportation services, even if it was for medical appointments. On the other hand, Medicaid have programs that may provide funding to cover the cost for transportation service as long as the service is used to go to a medical appointment. Medical alert systems are electronic monitors that are designed to send a signal to medical monitoring companies when an urgent medical attention is needed. This type of service is very useful for people with the medical conditions who live alone. This gives them the option to live alone and have access to care at the same time. Emergency medical alert systems are commonly used for people with the high risk for fall, but with the recent advance in technology, it has been utilized to provide the much needed help in emergencies related to others' illness such as diabetes, heart attack, and stroke. Now I'm going to talk about what types of services are provided in long-term care facilities. First is skilled nursing homes. This type of facility is ideal for people who needs constant nursing care. Resident in nursing homes usually requires higher level of care that are provided by skilled caregivers, and there is also on-call medical professionals 24 hours a day in case of emergencies. Nursing homes can range in size and services. It can be for elderly people with the complex medical needs, as well as for people who are recovering from a serious injury or illness who needs months to recover. The second type is assisted living communities. Residents in this type of long-term care facility are often more independent and don't require complex medical care compared to nursing facilities. This is more of a home-like setting where each resident has their own unit like an apartment or hotel. The services can range from 24 hours supervision, preparing meals, taking medication, transportation, and housekeeping. Long-term care in nursing facilities and assist living had issues that were already apparent but has been highlighted by the COVID-19 pandemic. First is the flawed delivery system that favors institutions such as a nursing home than home-based long-term care. Family members who prefer to use other options of long-term care often find that the standards or requirements are very difficult. Moreover, even those who were able to do home based long term care find it hard to have a con- continuity of care. Long term care often defaults to being in a nursing home which have long standing issues on how it is financed and structured. Because of these flaws, nursing facilities are understaffed and often lack trained infection prevention personnel. Nursing homes that were understaffed even before the pandemic has been have seen serious staff shortages because of different reasons related to the pandemic, and this resulted to delayed or not efficient delivery of care to the patients. The ban of family visits also left patients with no family support that is important for their well-being. Family members visit to patients to do help patients do day-to-day tasks, which gives patient a sense of normality and it's good and is good for their mental health. The next weak point in long-term care facilities is that there is an increased number of younger patients in nursing facilities that were designed and operates in a system designed for the elderly. The most recent available data from the National Center for Health Statistics is the 2015-2016 long-term care providers and services user in the United States report. The data showed that 16.5% of long-term care users were under the age of 65, which is a fast growing number. There are efforts to remodel the system of nursing facilities to adapt in the changing population demographics. Another alarming issue in long-term care facilities is the lack of federal law directing staffing ratio. The Nursing Home Reform Law of 1987 has not been updated since the reform was made over 30 years ago. There is no clear guidance on the nurse to patient ratio, and this is unsafe for the patient and the healthcare providers. The need to have a clearly defined staffing ratio is very important, especially now that we are seeing a change in the population demographics and services in nursing facilities. Patients or residents in understaffed nursing homes are prone to abuse by overworked and burned out staff. Last October, the governor of New Jersey signed a law requiring reforms to the long-term care industry, and included the reform is establishing minimum direct care staff to resident ratio in long-term facilities. This is a good example for other states to follow. Addressing the issue of understaffing will improve the quality of services provided to the resident and will result to a safe and efficient environment. There is a projected increase of baby boomers. The population aged 65 and older is expected to increase by 66% through 2035. There is an even sharper increase in the population aged 80 and over. Even with the projected increase of elderly population, the number of residents in nursing facility continue to fail. This is due to different factors such as increase in multi-generational households where two or three generations live together and numbers of the family can provide care to the elderly. Although there is a good alternative to nursing facilities, not everyone has the luxury of living with and receiving care from family members. In conclusion, the flaws in the long-term care system can be fixed with the support of the state and federal government, as well as non-government organizations that are promoting the much-needed change in the system. We have seen the effort of these flaws in the delivery and quality of care in long-term care facilities. I believe that something should be done soon to improve the system, but it's important that it should be evidence-based revision. This is the end of my presentation, and these my references. Thank you for listening to me. And if you have a question or a comment, please leave them in the discussion.